So what is a level 3 trauma center? A trauma center is a hospital that has met the rigorous requirements of the American College of Surgeons Committee on Trauma to ensure the hospital's ability to provide optimal care to anyone who has sustained an injury.
What does a Level 3 trauma designation mean for Greenwich Hospital? Level 3 trauma designation means that our community and the surrounding communities can receive comprehensive care closer to home by providers they know within a hospital they trust.
What does this new designation mean for the Greenwich community? It means that if bad things happen and a traumatic injury occurs, Greenwich residents now have a credentialed trauma center in downtown, close to home, where they can receive up-to-date, tailored trauma care from a program that has been heavily vetted by the American College of Surgeons and is firmly supported by the Yale New Haven Health System and our field-leading colleagues within the Yale School of Medicine.
What is the difference between a trauma center and the ER? A trauma center provides more staff and resources beyond the first line of the ER staff. Their role is to triage and safely get the patients to their next phase of care. A trauma center provides multidisciplinary teams to meet that next phase of care for trauma patients. It takes dedication and recognition of urgency from everyone involved, from anesthesia to transport to the blood bank. Everyone needs to work harmoniously for the best care of these patients.
When should someone go to a trauma center? You should go to a trauma center if you sustain a motor vehicle, bicycle, or scooter crash, sports injury, or a fall after which you have any significant pain, swelling, weakness, dizziness, or trouble breathing. Even a minor ache could be a symptom of serious injury if you have other medical conditions such as heart disease, diabetes, or take blood thinners.
Who will be caring for me at the trauma center? Well, when you go to a trauma center, trauma care starts in the field with our ambulance crews. They have state-driven protocols to help them decide when someone needs to be brought to a trauma center. We work very closely with our EMS partners to make sure that injured patients get to the right services at the right time. Trauma care is not just about care in the emergency department. It is about making sure that we have the providers and resources to meet any needs. These include not just the doctors and nurses, but also our radiologists, our anesthesiologists, our lab, blood bank, social work and discharge planning teams, and our injury prevention specialists.